Good evening. I'm LaShonda Kimmons, and I will be presenting today on behalf of Sarah Hardison, Julie Iddings, and myself. Today, I will discuss the need for the online enrollment implementation for Conestoga Valley School District. CVSD is ready for change now because it hired a new HR director. When the former director resigned, others in the office had to take over in the interim. CVSD realized its system for collecting new employee information by paper is time-consuming, and an online enrollment system is imperative for reduction of errors and process improvement. An example of this is a newly hired secretary. This secretary needs to be onboarded for her benefits. However, she is not able to begin because she has not submitted all of her benefits paperwork, and now the HR team is left trying to track it down. Now, in this particular district, benefits begin immediately upon date of hire. With Aetna's online enrollment system, an employee will enter the information themselves, making it simple and easy to understand. Human resources will not be liable to track down missing information, thus delaying the process. The stakeholder group includes the superintendent, the CFO, the leadership team, and the school board. The resistance will come from some of the leadership team and some of the teachers. Now, the principals are used to making the decisions in the absence of the HR director, and now they will not be able to do so. They will have to follow a proper process, and it will be redirected through the Human Resources Office. They will not have a hands-on approach to employee paperwork, and it will be an internal online system only visible to Human Resources, the CFO, and the superintendent. The teachers will be solely responsible for their information and be forced to take ownership. Therefore, this is when the resistance may come into play. The implementation strategy will be a demonstration of Aetna's online system and ease of inputting information. Estimation of time-saving analysis of human resources staff not inputting the information in anymore, and a step-by-step guide of time frame for implementation plan. Why is CVSD in need of an online benefits portal? Now, the current legacy system in place is paper-based and entails an 8-step process. The errors associated with the current process is the confusion of new hire paperwork versus the benefits paperwork. Liability issues arise when employees become confused with benefits options, such as considering Roth IRA versus the 403B. Often HR personnel are sought after as advisors to determine which option is best. However, as prohibited by school regulations, the HR professionals are under strict guidance to not answer such questions concerning benefits packages. The transference of paperwork increases the potential of internal privacy factors of employees' personal information. Why this solution? We want to be able to provide immediate access for employees to research benefits information at any time, and Aetna can do just that. Aetna's online dashboard provides immediate access to insurance tools for costs of prescriptions, estimated cost of doctor's visits, the nearest doctor's offices, and a savings calculator. Aetna services its customers by taking security measures to prevent illegitimate activity by reducing the use of social security numbers by doctors' offices, decreased phishing attacks, mobile security barriers, and secured patient identification prior to retrieving personal information. Statistics show that 4 out of 5 employees enroll in the wrong health plan. When employees aren't informed in their benefit decisions, they're left either overinsured or underinsured. Nearly 90% of employees feel technology improves their understanding of benefits. A modern benefits platform that includes consumer-friendly, data-driven decision support tools can transform the enrollment process into a simple online shopping experience that guides employees to the best option for their health and financial needs. In fact, 49% of employers agree that this type of best-in-class employee user experience is the most valuable outcome of implementing a benefits administration platform. As of now, the cost affiliated with the Aetna plan is unknown in regards to IT staff and the staffers needed to implement the online system and training. Why are we looking to this solution? It reduces the time for staff to input the information. New hires will take ownership of their information. It reduces mistakes, and papers will not be left in files in a cabinet. The benefits of this platform is that it's user-friendly, it's easy to understand the benefit questions. They will be able to change their forms, access their information, view apps, and be in control. And also it reduces the time HR spends in handling the employee forms and allows the HR department to focus more so on pressing matters within the organization. We look to begin this process September of 2019 and in April of 2020. Within the first 30 days, we will observe and schedule meetings with the tiers of people in senior administration and meet with building administration to understand the current CVSD hiring from start to finish process, and also schedule meetings to understand the current budget. Ongoing from the 30-day plan, 60 days out, we began connecting with Aetna representatives about successful online benefits transitions. The 90 days from today, we will begin implementing incremental changes in collaboration with district leadership, begin updating contracts, develop communication and training plan for an online benefits platform. 8 months to a year from now, the online benefits transition will be complete and technology platforms will be assessed for HR integration. We will be able to identify in the course of a year what systems are in place, and the second year prioritize which systems need to be reassessed. Within this whole transition of the time frame, teamwork and clear communication will be the major key to a successful implementation. So how will this impact employees? It will be an easier enrollment, more informative, improve efficiency and accuracy, and shorter enrollment cycles, and be able to easily update information and receive email confirmations and reminders. Let's take a look and see what clients are saying about Aetna. Lawrence Foster states that my last 3 companies used Aetna. They have always handled my claims swiftly and competently, competitive rates, and they have a huge inpatient doctor list that always fits with my doctors. So what can users look forward to? Aetna's mobile app, where users can view benefits and progress towards their deductibles, access their member ID card, quick review and see account balances, manage and pay claims, easily find doctors and facilities, and get medication details and cost. So in conclusion, we see that there is a very important need for Conestoga Valley School District to transition to an online benefit enrollment system, because this would allow each employee more accessibility to medical information. The benefit system would become mainstreamed, and in turn, the process would be user-friendly, more efficient than the paper system, and also allow data to be used in order to improve any system changes needed. Employees will be more in control of their benefit enrollment, meaning more informed about the benefits that are best for them, and eliminate overpaying or not getting the coverage that they need. All the forms would be complete and information would not be missing. Any questions can be directed to the Aetna representatives, and users would have the ability to see which doctors are in their network, understand how much they have paid towards their deductible, as well as other important information right at their fingertips. Thank you so much for your time, and we hope that you enjoy.